Community College. I'm a student nurse, and your nurse has asked me to give your tube feeding today. Would that be okay? Okay, let me just check your identification. Could you tell me your name and your date of birth? Okay, very good. I'm just going to go wash my hands, and then I'll come back and we'll get started. So I'm going to wash my hands, and I'm going to put on exam gloves. You see them on there. Okay, first thing I'm going to do is mix your medicine with some water. That's what I'm doing here. And today you're going to be getting Lasix and lisinopril. The Lasix, do you know what that's for? That's right, that's your water pill. And you're getting lisinopril, that's for your blood pressure. That's right. Okay, so I'm going to pour the water into the pill. I'm not going to use the syringe to mix the water in because it will spill all over the place. So I'm going to pour the water in, and I'm going to stir it up. Okay. And I've already done my first 2 checks before I came in the room. And I've washed my hands and I have gloves on. Then I'm going to, while the medicine is dissolving, I'm going to check placement of the tube. So I'm going to put 30 cc's of air into the tube. I'm going to hook up the syringe. I'm going to put the stethoscope in the left upper quadrant right by the gastric tube, and I'm going to push it in and listen for the whoosh. And I'm going to pull back, and I'm going to check pH. Anytime I take the syringe off, I have to pinch the tube or it's going to squirt back at me. So I'm going to check pH. pH is 3, so it's less than 4, so that's a good indicator that I'm in the stomach. I'm going to hook the syringe back up again, and I'm going to pull back and check residual. I have 30 mils of residual. It's less than 200, so I can replace the residual. So I'm going to push it back in slowly. I'm going to unhook the tube. I'm going to recap it. I'm going to pull this apart. I'm going to go rinse it off. Then I'm going to set my plunger on the paper towel. I'm going to have my water and my medicine and my formula all lined up here. I'm going to give the medicine first and then the formula, because the medicine can either be given on an empty, with or without food. I'm stirring this up again. Set to go. I'm going to put a clothing protector over the patient so that where the syringe attaches to the junction of the tube, if any formula or gastric juice pours back, it's going to hit this instead of the patient's clothing. And if the syringe becomes disconnected from the tube, I won't give them a shower. Okay, so again, I'm going to pinch the tube. I'm going to insert the syringe, and I'm going to give it an extra little crank so that it's on there tightly. I'm going to hold it, and I'm going to, I would have the equipment situated to the right of me because I'm right-handed. Okay.
That didn't happen.
Have the equipment to the right of me. Okay, so I'm going to give the meds first. First I'm going to check tubing patency. How do I check patency of the tube? I'm going to flush with 30 to 60 of water. So I'm going to flush with 30 to 60 of water. I'm going to let it flow in by gravity. When the syringe isn't quite empty, I'm going to pinch it off. Then I'm going to give the medicine. Let it run in, pinch it off. I'm going to give 10 of water, let it run in, pinch it off. I'm going to give the second medicine. This is your lisinopril. This is for your blood pressure. You want to be careful getting up because it might make you a little dizzy when you change position. I'm going to let it run in, I'm going to pinch it off. I'm going to flush again. After I've given both medicines, I'm going to flush again with about 30. I'm going to pinch it off. Then I'm ready to give the formula. I've already done my third check. I've checked that it's the right formula. I've checked that it's not expired. I shake it up. I open the can. And I'm going to give the formula over about 10 to 15 minutes. And I can raise or lower the tube to make it faster or slower. I'm going to, as I'm giving the formula, I'm going to ask the patient, are you feeling okay? You're not getting too full? Let me know if you start to cramp or if you start feeling too full, and we'll slow it down. So I'm going to give that over about 10 or 15 minutes. Then I'm going to pinch the tube. I'm going to flush the tube with 30 to 60 of water. I'm going to pinch it off. I'm going to remove the syringe, and I'm going to close the cap. The patient needs to be sitting at a minimum of 30 degrees. If they're getting a bolus feeding, a lot of times I'll put them in high Fowlers, 90 degrees or between 60 and 90 degrees, and you want to leave them sitting in that position for at least 30 minutes, and then they can lay back down. Okay, we're all set with your feeding. I'm just going to clean up my mess. Is there anything I can get for you? Here's your call light. Let me move the table closer to you. I'm going to clean up my stuff, and then we'll make sure that your Kleenex is close to you, and your call button, and your urinal. And I'll be back to check on you in about a half an hour. You feeling okay? You're not having any cramping? Okay.